Radiation proctopathy is a much bigger problem than we as clinicians realise, and whilst we are as clinicians focused on bleeding, we may actually find from a patient perspective there are other aspects of radiation proctopathy which are far more troublesome from their perspective. PuraStat is offering a wonderful bridge between non-invasive and invasive treatments in the sense that it seems to be incredibly safe, very well tolerated, and potentially prevent some of the longer term complications. I'm John Hancock. I'm a consultant gastroenterologist. I work in the northeast of England. I am very much a generalist in terms of gastroenterology, but I have a specialist interest in therapeutic endoscopy in particular. My experience with PuraStat, it was partly due to the range of practice that I undertake, and in particular with my interest in radiation proctopathy. I would emphasise I'm not a specialist in radiation proctopathy, but as I think a number of clinicians will acknowledge, we often inherit particularly complicated patients. It's often a very challenging issue to deal with, particularly in those who've been refractory to other treatments. My understanding of radiation proctopathy is essentially it's an ischemic problem, i.e. it's a blood supply problem to the mucosa itself. The type of problems the patients present with are frequency, urgency and fecal incontinence, pain, ulceration, and in particular bleeding is the key problem that I'm often asked to manage. My experience is virtually solely confined to chronic radiation proctopathy, and again it tends to be the patients who have remained refractory to other treatments. Most patients I tend to look to formaldehyde, which again using as an instillation treatment. That can be very, very effective in my experience, but again over time, whilst I acknowledge it's extremely effective, I'm very concerned about potential side effects and in particular the long-term carcinogenic potential. PuraStat is a very exciting tool that we have available. It is very effective in terms of providing rapid hemostasis, but I think the fascinating aspect with PuraStat is its potential to heal, and we may offer us the opportunity to modify the process of chronic radiation proctopathy. My experiences of using PuraStat in radiation proctopathy, I have no hesitation in recommending it. To any clinician who is in a situation where they feel that radiation proctopathy is a problem and they are concerned about offering some of the invasive treatments, would be consider using PuraStat, give it a go and see what you think.